My name is Scott Daniel. I'm a physical therapist here at CMH. I've been here for about 14 years. I've trained in outpatient and also certified in lymphedema treatments.
I'm Vanessa Rufiner. I am a PT assistant. I've been here for 7 years. I work in the outpatient clinic, and I am also lymphedema certified.
Lymphedema, by definition, is a protein-rich fluid in the extracellular space. So basically, it is an accumulation of protein molecules and extra fluid that can come on, and typically it gets picked up by the lymphatic system and returned to the circulatory system. Unfortunately, sometimes after breast cancer surgery, removal of lymph nodes, you can get a backup in the system, and so now you get an accumulation of that fluid that's not coming out of the limb, in this case typically an arm, and so you get an increase in swelling, increase in size, discomfort, fullness, those kind of things.
So we work with range of motion in the arm. Anytime you get motion in the joint, that's going to reduce inflammation. But as far as lymphedema goes, we do MLD, which is manual lymphatic drainage, and we kind of manipulate those tissues to help the body drain the fluid.
So that's kind of what we do, is we help to educate people and help them to understand the idea of what it is, and then what we can do to manage it or take care of it. And that comes through, like Vanessa was saying, through the MLD, the manual lymph drainage, and that's a skill that we can teach patients to do themselves. And then also with some compression. And in the clinic here, that comes in the form of compression wraps that we do to help move that fluid out, in conjunction with the manual lymph drainage and massage that helps to move that fluid. And then also education on skin care, make sure that the skin stays in good condition, you're not breaking down, drying out, cracking, those kind of things. Dr. Leo's great. He's very much on top of, and their whole crew over there is very good about managing and understanding lymphedema. If they start to see that at all, they're very good about sending folks to us quickly to make sure that we're not missing that in the process of their cancer treatment or their post-op mastectomy.
So when you're not close to us, you would wear your compression bandages and you would do your self-MLD at home to manage those things.
Once we complete the round of therapy sessions here, then we transition to a home program, which is going to consist of typically some sort of home program for exercises to try to help promote improved lymphatic transport in conjunction with the MLD, or the manual lymph drainage, and then also with some type of compression. And that usually comes in the form of a compression garment. There's a variety of different garments that are out there. It's sort of like trying to buy a new car. Sometimes it gets a little overwhelming and confusing, and so we're here to try to help that process, make that a little bit easier on you, determine which compression you need, flat knit, circular knit, compression via Velcro. So there's a lot of options, a lot of things that you can look at from that standpoint, and we try to help with that so that they can continue to manage and control that edema once they're outside of the clinic. After we graduate into the realm of physical therapy, then there's an opportunity for continued training, and that's where the lymphedema specialty comes in. It's one aspect of physical therapy that we can specialize in, and that comes in the form of about 135 hours of hands-on specialty training for that area. And so we do a 40-hour online training initially, and then we go to a location. We do about 9 days of actual hands-on manual therapy training, learning the techniques, the sequencing, the way to clear, compression garments, those kind of things that come along with it.
I love the patients and getting to know the patients, and then ultimately helping the patients, and they feel better, and it's very gratifying.
Yeah, there's a lot of variety, especially in a rural clinic like this. We see a lot of different things. Lymphedema is one of those aspects that we get to help patients with, and so it's neat to be able to see them progress through those stages and get to a point where they're able to move better and function better throughout their daily activities.